Hi, it's Dr. Centeno, and I'd like to talk about the difference between interventional and surgical orthopedics. Now, this is not to impugn my surgical colleagues, but merely to point out that there's a substantial difference between these two approaches. So there's a new exciting treatment approach called interventional orthopedics. Now, this is not surgical orthopedics. This is actually precise image-guided injections of orthobiologics that can facilitate tissue healing. In fact, this field is growing so fast that there's now a professional organization that's been formed to provide education and grow the field. Interventional orthopedics goes beyond just learning how to guide a needle to a certain spot in the musculoskeletal system. It has key tenets that make it quite different from the orthopedic surgical approach. So these are the key differences here between interventional and surgical orthopedics. And I'm going to go over each one of these so you can really get a sense of how these two approaches are very different. Surgical orthopedics has always believed that structure equals function, meaning if your MRI looks bad, we need to do a surgery to fix that. But the problem is that there are countless studies right now that show that that's not the case. So interventional orthopedics recognizes that sometimes the structure looks bad, but the function is just fine and there's very little pain. Another huge difference between the two approaches is that orthopedic surgery loves to cut stuff out. Take, for example, a torn meniscus. You go in and you cut that torn meniscus out. But interventional orthopedics understands that the high-level research that shows that that stuff works just isn't there. In fact, we have more research showing it absolutely doesn't work to cut stuff out. So interventional orthopedics isn't focused on taking things out that don't need to be removed. So yet another difference between orthopedic surgery and interventional orthopedics is that orthopedic surgeons love to restructure joints. However, there's very little research that this actually helps in the long run. In addition, surgeries heal to centimeter precision, but the body actually needs submillimeter precision to actually perform correctly. Another big difference is that orthopedic surgeons love to fuse joints, whether it's the spine, the toe, the wrist, the hand. They love sticking hardware and stuff. Interventional orthopedics doesn't do that. We recognize that the research that shows that this stuff works is sparse at best, and these are major destructive procedures that shouldn't be done at anywhere near the rate that they're currently being done. And while surgical orthopedics views instability as either really unstable or not unstable, interventional orthopedics recognizes that instability is a spectrum disorder, meaning that there's an awful lot of patients walking around out there that have unstable joints due to lax ligaments, and that those can be fixed with orthobiologic injections that are very precise. While in surgical orthopedics, subspecialization is everything, i.e. you've got the hip guy, the ankle guy, the knee guy. In interventional orthopedics, we recognize that that doesn't help patients, that the body is one connected machine. And if you do this work, you should be able to treat the spine, the hip, the knee, and the ankle, and the entire kinetic chain. And that breaking someone into pieces is not helpful for patients.